and how much time will be required to infuse the entire content of the bottle. So first question is regarding the rate of intravenous infusion. You have to set the rate. Rate of intravenous infusion of dopamine is already given 2 microgram per kg per minute. So it is per kilogram. You have to calculate the rate for this patient. And the patient's weight is 60 kilogram. So first of all, you have to calculate the dose of dopamine for this patient. So the weight is 60, rate 2 microgram per kg per minute. So dose required for this patient is is 60 into 2 microgram per kg. And the answer is 120 microgram per minute. If we convert this microgram to milligram, the answer will 120 microgram to milligram. .12, okay, 0.12 milligram per minute. So the 0.12 milligram per minute is the rate of intravenous infusion for this patient. That means you have to administer 0.12 milligram of dopamine in 1 minute. .1 milligram, we have to convert this value in milliliter. As we are giving this drug via intravenous infusion, we have to calculate the drops of intravenous infusion. So to calculate the drop, we have to convert the dose of dopamine into milliliter. So here 40 milligram of dopamine ampule is dissolved in 500 ml of dextrose solution. So 40 milligram is dissolved in 500 ml. So for 40 milligram of dopamine, we require 500 ml of solution. Here the dose for this patient is 0.12 milligram. So for 0.12 milligram, we require how much amount? .12 into 500 divided by 40. And the answer is 1.5 ml of solution. Yes, answer is 1.5 ml. So we require to give 1.5 ml of dopamine solution in 1 minute. So in 1 minute, 1.5 ml of dopamine solution should be administered to the patient. Now this is the rate of intravenous infusion. So how we will set this rate for this patient? By calculating the drops. So now we have to calculate the drops. 1 ml is equal to 20 drops. And here for this patient, we require 1.5 ml. So for 1.5 ml, the answer is 30 drops. Therefore, the rate of infusion will be 30 drops per minute for this patient. Yes, good. Clear, everyone? So we have to set the 30 drops per minute of dopamine solution to reach the rate of 2 microgram per kilogram per minute. So this is your answer of first question. Coming to second question. How much time will be required to infuse the entire content of the bottle? As we have seen here, we are administering 1.5 ml of the solution in 1 minute. So for the administration of 1.5 ml of dopamine, we require 1 minute. And here we have dissolved dopamine in 500 ml of dextrose solution. So to administer the 500 ml of solution, how much time will require in minutes? For 1.5 ml, 1 minute. So for 500 ml, yes, it's around 333 minutes. Not 33, it's 333 minutes. Yes, 333 minutes. And in hours, three hundred and 33 minutes is around, yes, 5.55 or around 5 hours. So the answer will be 5 hours. So to infuse the entire content of the bottle, we require 5 hours. Clear, everyone? So in exam, you may ask another drug with different condition of the patient, different weight. You have to calculate the dose accordingly. Now coming to one important aspect that we have discussed earlier also, the schedule of the drugs. I will go very briefly through this. What do you mean by schedule and why it is required? So drugs and cosmetic rules are the set of rules under which some drugs are scheduled according to their characteristics. There are rules for drugs, drug related standards, practices, and the requirements. These rules were first yes, in first example, we have discussed the route of administration, oral. And in second, the route of administration of drug was intravenous. So you have to keep in mind by which route the drug is going to administer in the patient. Accordingly, you have to calculate the dose of the drug. So for intravenous infusion, you require to calculate the rate for particular patient, and then accordingly you have to calculate the drops. And for oral administration, again, you have to calculate the drops given per orally. Okay, so for storage, sale, dispensing, and for the prescription of the medicines, there are many schedules. The name and their importance and uh, under the each heading there are many rules related to that particular matter. Previously, the schedule Y was there, but in 2019 the schedule Y is replaced by the new drugs and clinical trial rules 2019. This schedule Y was related to the conductance of the clinical trials, but now it is totally replaced by uh, another authority, the New Drug and Clinical Trial Rules 2019, that you have to remember. Amongst this schedule, you should aware about important three schedules that may ask in your exams that we will discuss. First is Schedule H. So the drugs under this schedule must be sold by retail only when prescription by registered medical practitioner is produced. So such drugs are known as prescription only drugs. So uh, for selling of such drugs, you require to have prescription. Without prescription, the selling of these drugs is prohibited. So you may find on the label of such drugs, it is written that Schedule H and prescription only drugs. The meaning of Schedule G. Under this, the drugs to be labeled with the word caution. And it is written that it is dangerous to take these preparations except under medical supervision. So the drugs which are falling under this schedule should be consumed under medical supervision only. So you may find a box warning behind the label of in the label of such drugs, and it is written as a caution. Schedule X, certain psychotropic drugs which require special licensing or for manufacture as well as for selling. So you need to remember these three schedules that may ask in your exams. Now coming to one important aspect regarding sterilization. The steps of hand washing. So this brochure you will find in any hospital at the area of when the hand washing area is there. In surgical OT side, you may find such brochure. So there are 8 steps of hand washing that you should follow. And now in this COVID era, we all are very aware about the importance of hand washing. But is it effective? We are effectively wash our hands so that we can prevent the transmission of disease. The transmission, we have to follow each and every steps of hand washing so that we can ensure that the total sterilization of our hands. So the first step is you have to rub your palm to palm. Second step, you have to interlock your fingers in between. Third, you have to clean your back of the hands. Fourth, you have to clean your base of the thumbs. Fifth, back of the fingers. Sixth, tip of the fingers or fingernails. And lastly, you have to clean your wrist. So these are the basic steps that you have to follow while hand washing. So we'll give you certain information regarding the storage and disposal of the medicine and biomedical waste. Regarding biomedical waste, you will learn certain instruction regarding the storage of the medicine. So how will you store your medicines at home? You will, first of all, you have to check the instruction written on the package of the medicine regarding particularly for that medicine. But the ideal storage, you have to choose cool and dry place. Medicines must be locked in a cabinet. You should keep the medicines high up so that children cannot reach the medicines. The medicines should be kept in their original child resistant containers. And always you have to close the medicine bottle properly and completely after every time you use it. There are certain don'ts about the storage of medicine. You don't have to store the medicine when the moisture level is high. For example, in the bathrooms. You don't have to store the medicine near the hot areas, like at the top of the refrigerator, near stove, or near windows. It may deteriorate the quality of the medicine. And don't store the medicine inside the refrigerator unless it is indicated or unless it is mentioned on the label of the medicine. Certain instructions regarding the disposal of the medicines. When you have to dispose the medicine, usually for the disposal, we are checking the expiry date of the medicine. So when the medication is reaching the expiry date. Second, any change in the color or the texture of the medicine. Then we have to dispose the medicine as it may affect its efficacy. So any change in color, any change in texture, you have to dispose the medicine even before expiry date. And where to dispose medicines? If it is tablet or a capsule, then first of all, you have to mix medicine with some undesirable substances like mud or any other undesirable substance. Then you have to seal it and then you have to throw in the dustbin. If the medicine is liquid dosage form like syrup or suspension elixir, then first of all, you have to mark out the personal information written on that medicine bottle. Then you have to mix the remaining medicine with some undesirable substance, or you can just add water to dilute the medicine. Then you have to keep that bottle in some opaque container, and then you can dispose that particular container in a dustbin. Drug take back program is offered by some pharmacies. So when this program is there, you can give back the medicine to that pharmacy also. And this is the biomedical waste segregation policy. You may find in hospital side also various bags, color coded bags are there for the disposal of waste, black, yellow, red, blue. And according to their color coding, the type of the waste you may dispose in that particular bag. So black bags are for the removal, disposal of the paper waste. So any paper cups, tissue paper. Yellow bag is for the disposal of infectious non-plastic waste. Non-plastic and infectious waste. For example, animal and human tissues, body parts. In surgical OT, you may find such type of tissues. In gynec, you may find placenta. So placenta is disposed in yellow bag. It's the infectious and non-plastic waste. So any animal tissue or human tissue, disposable gowns and masks are disposed in yellow bags. Other linen dressing materials. Then infectious and plastic waste are disposed in red bags, like intravenous tubing, pint bottles, cannula, syringes, urinary bag. In blue bin, you may dispose glasswares like vials or pints, broken or contaminated glasswares are disposed in blue bins. And sharp materials like needles, scalpel, knife are disposed in puncture-proof can. It is a white can. So you can dispose any sharp material in this puncture-proof can. So you need to remember which type of waste should be discarded in which color-coded dustbin. So that's all about today's practical. You have to write 2 assignments in your journal when you get your journal. But until you can try to solve these questions at home, you can take a screenshot of this assignment 1 and assignment 2. If you have any doubt, you can ask in chat box. So you have to solve these 2 questions. If you don't have any doubt, you can write your attendance in chat box.